Hi, and welcome to Caregiving during COVID-19. My name is Melody. I am a librarian at the North Shore Library, and we are really excited to be partnering with the Milwaukee Department on Aging, and they are going to help us with this presentation. We have Candice LeGros, who is a dementia care specialist, and she's going to be talking about caregiving for someone with dementia during COVID-19. So Candice, why don't you get started?
All right, thank you very much, Melody, for the introduction. Again, this is a short informational webinar that will focus around caregiving for someone with dementia at home. I will be covering reliable information sources for COVID-19, hand hygiene tips, how to structure someone's day, activity suggestions, online caregiver education sources, community resources, as well as caregiver self-care resources. Also, everything that is highlighted in a blue hyperlink throughout the presentation will take you directly to the resource website. And if you would like a copy of the slides, I will be providing my email at the end of the webinar, so you can send, so I can send this PowerPoint directly to you. Okay, it's being a little slow. Moving to the next slide. Okay, there we go. First of all, I would like to start out by thanking each and every caregiver, whether that be a family caregiver, a friend, a helpful neighbor, or a paid caregiver. It is all of your amazing work that is getting us through this strange and difficult time in our lives. I heard a quote a few weeks ago that really resonated with me. The quote was, "Remember, this is only a chapter, not the whole book." Even though we are all focusing on just getting through this time right now, remember that this time will pass and we will all move on to another chapter in our lives. Okay, and a lot of people haven't heard of a dementia care specialist before, so I just wanted to give a little brief background on what DCS does. So just to give a brief background, DCSs are based in county aging and disability resource centers. There are currently 33 dementia care specialist positions, serving 34 ADRCs covering 56 counties and 5 tribes throughout Wisconsin. The DCS program started in 2014 as a part of the Wisconsin Dementia Care redesign, as it became more and more apparent that the number of people affected by dementia is expected to increase dramatically as the baby boom generation ages. The state plan is to one day have the entire state supported by dementia care specialists. And this is the most recent coverage map that we have for DCSs in Wisconsin. So as you can see, we're getting pretty close to meeting that goal. And now I would just like to cover the 3 main job goals of a dementia care specialist. So the first one is to support the Aging and Disability Resource Center staff and county programs to be better prepared with the knowledge and resources to support individuals with dementia and their families. The second is to act as a catalyst to create dementia-friendly communities. DCSs may work with businesses, employers, local organizations, and the community to raise awareness of the unique needs of individuals with dementia and their families. And the final and most important goal is to assist individuals with dementia to remain active and independent in their homes for as long as possible and provide support, education, and resources to their caregivers and their families. Okay, and first off, I would just like to kind of go over reliable COVID-19 information sources. Sometimes we might see stuff that's like, oh, I wonder if this came from a reliable source. So I kind of have 3 main reliable information sources for COVID-19. So the first one is the Center for Disease Control and Prevention. They have reliable information on the disease, symptoms, how to protect yourself, what to do if you're sick, data on COVID-19 in the US, and frequently asked questions. The Wisconsin Department of Health Services website, they have Wisconsin-specific COVID-19 data and statistics. They also have online health screen assessments if you need, to see a doctor, information on the Safer at Home order, information on high-risk groups, resources in the community, as well as much more. And then the last one is the Federal Emergency Management Agency. They actually have a rumor control website. So if you kind of hear something like, I don't know if that's true, this website can kind of debunk all of those rumors we've been hearing about COVID-19. Just an example from the website, there's a rumor out there that the 5G cell phone technology is going to cause coronavirus. That is not true and has been proven to not cause coronavirus. Okay, and then just a quick note before I continue, for people living with dementia, increased confusion is often a first symptom of any illness. If a person living with dementia shows rapidly increased confusion, please contact your health provider for advice. Unless the person is having difficulty breathing, high fever, or other really intense symptoms, it is recommended that you call your health care provider instead of going directly to the emergency room. Your doctor may be able to treat the person without a visit to the hospital. Oops, there we go. Okay, so hand hygiene tips. First off, I would like to say that, dementia does not increase your risk for COVID-19. However, dementia-related behaviors, increased age, and other common health conditions that often accompany dementia may increase someone's risks. For example, people with dementia or people with Alzheimer's disease and other dementias may forget to wash their hands or take other recommended precautions to prevent the illness due to the damage going on in their brain. So here are just a few quick helpful tips for good hand hygiene, okay? So the first one is the caregiver might need to increase the verbal or written reminders to kind of remind the person with dementia to practice those good hygiene practices. Second, maybe consider placing signs in the bathroom or, throughout the house, maybe by the kitchen, to remind the person with dementia to wash their hands with soap for 20 seconds. The person may need to demonstrate thorough hand washing. If you want to watch a video on how to properly wash your hands, there is a link there to the AARP website that has a video that shows you how to wash your hands properly. And lastly, if the person cannot get to the sink easily, a good alternative to hand washing is to use alcohol-based hand sanitizer. Okay, and now I'm just going to go into kind of thinking about how to structure somebody's day. So daily routines can be helpful to both you, the caregiver, and the person with dementia. A planned day allows you to spend less time trying to figure out what to do and more time spent on activities that provide meaning and enjoyment. Also remember that transitions are more difficult and take more time for someone with dementia. So patience and reassurance is key. For example, a person with dementia that might have been attending like a day program now has to adjust to being home and no longer going to that day program. This transition will take some time for them to adjust to the daily routine. Also, most importantly, increased activity during the day may help to reduce instances of agitation, restlessness, or other unwanted behaviors in a person with dementia. So when planning your person's day, just consider, what did they used to like, their dislikes, strengths, ability, interests. What time of day, do they function their best? How did they used to, structure their day? Maybe when they were younger, working. What did they like to do? And always allow time for meals, bathing, dressing, eating, and other activities of daily living. And also please stick to regular times as best you can for waking up and going to bed. This is especially helpful if the person with dementia has, is having sleep issues, or if they're having sundowning behaviors, which is getting more confused in the evening because they're not maybe able to wind down and relax. So really sticking to the same time to get up and to go to bed. Okay. And during this time, we're having to stay physically distant, but we also need to remember that we need to stay socially connected with each other. So get creative with friends and family, utilize phone calls with friends and family, maybe a scheduled phone call every day so the caregiver, you can get a break, the person's, occupied for a little bit, gives you a chance to do some self-care, whatever else you want to do during that time. Maybe tell them to do a drive-by visit. They can wait from the car, you can talk at a distance from each other. Also try out video chatting to supplement those face-to-face interactions. You can use Skype, Zoom, Apple FaceTime, Facebook Messenger, Google Meets and Hangouts, and the WhatsApp for smartphones. If you're kind of not sure which one to try, Skype has a really nice first-time user video, and you can click on it right here in the blue. Okay. And then I would just like to note before going over these activity suggestions is to keep in mind where your person is at in their disease progression. Also consider their abilities, what can they do, and also their interests. Would they like this? Would they not? Because, everybody's different, and that's no different for people with dementia. Everyone is different, and you might have an interest that you like, and then if you try something, you might not like it. So take all these with a grain of salt. So the first one is the Alzheimer's Association. They kind of have a 50 activity suggestions list, and I really like theirs because they kind of break it up into different categories. So they have outdoor, indoor, personal activities, kitchen activities, and family traditions. So they kind of group it up into different categories. The next one is the Alzheimer's and Dementia Alliance of Wisconsin. They have also a very long list of recommended home-based activities. When you're trying to maybe get the person to be interested in activity, remember to maybe decrease background noise when you turn off the TV, decrease distractions. They also recommend, maybe reminiscing at, old photos, old family movies, kind of like those positive memory, focusing on positive, happy things. The next one is Senior Link. That's kind of a blog for caregivers, and there's lots and lots and lots of activity suggestions. So with these first three, you'll never be short of a list of activities to try. The next one is depending on the person's interest and kind of where they're at. If they did like to do kind of that paper Sudoku word searches or jigsaw puzzles, and maybe you're not able to go out and buy those anymore, they're actually offering virtual Sudoku word search and jigsaw puzzles, and they're really fun, really easy to use. Lots of different options for those three. The next one is virtual storytelling. So the first one is by MemoryWell. And what this is MemoryWell offers a storytelling platform to preserve family memories. Their professional journalists write life stories that can be digitally shared with your loved ones, your family. So how it works is you're interviewed by one of their journalists. It takes about less than an hour, and the story is written and edited by MemoryWell within the first 5 to 10 days of the interview. And then once that's completed, you are sent a private link to kind of access that story from their website. You can even add photos, videos, letters, documents to kind of build the timeline. And now due to COVID-19, they're actually offering their timeline package for free, which creates an interactive digital timeline to kind of animate and preserve a person's life through, videos and pictures and letters and notes. It's kind of neat. The next one is time slips. So some of you might have heard this before, some of you haven't. And what time slips is, it's a creative storytelling program for people with memory loss. On their website, they have webinars, free storytelling resources. They have a really creativity center that gives examples and guides on how to kind of use time slips with your person. Okay. The next one is virtual poetry. So for those of you who are really into poetry, this is a really neat resource. So it's the Alzheimer's Poetry Project, and their program is called Poetry for Life. It's a 30-minute long show that kind of sounds like an old-fashioned radio show. It's suitable for all ages, and of course is meant for people who have memory loss. If you are interested in kind of listening in and joining that Poetry for Life program, you can contact the main poet, Gary Glazner, for more information, and you can get to his information on the link right next to it. Okay. And the next one is memory cafes. So a lot of you might have been attending or heard of memory cafes before this happened. Typically they were in-person events, but now they've kind of been switched over to a virtual format. But for those of you who haven't heard of memory cafes before, they are opportunities where people with mild cognitive impairment, early stage Alzheimer's or related dementias, they can go with their care partners or families to kind of socialize, have fun with others kind of going through the same thing that they are. A memory cafe really has, no stated agenda or purpose except to enjoy each other's company. Cafes provide a time where you don't need to really focus on the diagnosis, just, having a good time, connecting with others, connecting with other families and other people with dementia and creating new friendships. And there's a couple different options for virtual memory cafes right now. So the Jewish Family and Children's Services, their Percolator Memory Cafe Network, they've been having online virtual memory cafes for a while. So that link there, you'll have lots and lots of different options to choose from. And then we also have one here in Wisconsin. It's the Fox Valley Memory Project. They're also doing a series of virtual memory cafes. And if you're interested, please email Brianna at foxvalleymemoryproject.org.